Hello, I'm Dr. Karen Leong. I'm a plastic surgeon here in Newport Beach, California. In my practice, my philosophy is I want to journey with you from the time you're a teenager thinking about breast implants all the way up to when you're a grandmother saying, oh my goodness, this is not my neck, and everything in between. But really what I think is, I'm a woman. I'm going to go through those same changes, and I want to be with you every step of the way. So your passions are my passions. What I do particularly love, it's hard not to, again, because I'm a woman. I care about my face and I care about my breasts. So that's what we're going to focus on here. And I want you to make the choice that's best for you. I want you to find someone that you're very comfortable with, someone that you trust, because to be very honest, this is a relationship that I'm hoping we'll have throughout your lifetime and through mine. What I think is special about my practice, we are a group of female physicians, and we love the women that we treat, men too, but we try to offer a one-stop shop so that you can have all your needs met in a very calm and welcoming and comfortable atmosphere. So I think that's something that we can offer. We like pretty things, we like things that smell good, and we want to make you feel the best you can about yourself. When a woman comes in for a breast consultation, she usually has something in mind, whether she wants to go bigger, whether she wants to be perkier, whether she wants to be smaller, or whether she already had implants and she's decided at this time, it's too big. I still like them, but not the way they are now. So the most important part is you. You tell me what you're aiming for, and I work with you to achieve those goals. When it comes to breast implant choices, I talk with you through all the options. I don't have a personal bias, but I know some patients do. Their concerns may be about ruptured implants, how silicone does compared to saline, whether it feels natural. Maybe they had one sort or the other and they don't like the fact that they can ripple, or that their partners know that they're there, or the fact that when they wear a bra, it just looks fake. So again, you and I work through it together. You tell me what you're trying to achieve. I tell you whether or not we think it's possible, and then we decide on a plan together. So I heard about the IDEAL implant a couple years ago. I was very intrigued because I think it's important when you're choosing an implant in a surgeon that it be a board-certified plastic surgeon. That means you get the highest quality from the most well-trained surgeons. And when Dr. Hamas came out with this implant, I said, well, that's brilliant. Because if I were going to choose an implant for myself, I would want the security of knowing that if it were to burst, I don't have to worry about silicone in my body. The fact that the burst rate is so low, less than 1.8%, amazing. And the fact that if I have to worry about scar forming around the implant, also known as capsular contracture, that the rates are lower than both traditional saline implants and silicone implants. Plus, if I can have a saline implant that feels and acts like a silicone without the risks of silicone, I'm in. So after having IDEAL in my practice, I find that, obviously I feel a little bit biased as I've described in my earlier talk, but I pretty much have gotten rid of traditional saline implants. I just don't see any benefit in a water balloon when you can have something that looks and feels natural and lasts a good long time with fewer complications. My patients kind of feel the same way. Their biggest concerns and their biggest desires is to have a natural feeling implant, which this is, and an implant with fewer complications, which this is. When we talk about price point, I think it's comparable. I tell them that it's an investment. If you're looking at this in the long term, 10 to 12 to 20 to 30 years, is $200 a big difference? No. Just think about what you're buying and what you're getting out of it, and it's worth it every time. If a woman asks me how long a typical implant lasts or whether or not she should have them replaced every 10 to 12 years, my personal recommendation is if you have a silicone implant, the shells, even though the cohesivity, which means the gumminess of the implant itself, has improved over time, the shell, the wrapping around it, is about the same. So even though the manufacturer says they're good for potentially a lifetime, or at least 20 to 30 years, I still say for safety's sake, we know that those shells tend to break about 50% at 10 years, up to 80% at 20 years. I would recommend my patients replace them every 10 to 12 years. With the IDEAL implant, because it's filled with saline, which is just salt water, I don't have to worry about that. I don't have to send you for an MRI every year. You don't have that additional cost. And if it breaks, I know it's a little bit softer, but it's not dangerous to you. You don't have to replace them every 10 years. We can keep going. When patients tell me how they feel after surgery about having the IDEAL implant, it's kind of interesting. If it's a first-time implant, I think it's a wash. They don't know what it feels like to have an implant or not, so they're pretty happy with it. For people who go sideways from silicone to the IDEAL implant, they really can't tell the difference. They say it feels about the same. They don't have any of the sloshing, and they have that peace of mind of knowing that if anything happens, it's just salt water in their body. So overall, I'm very happy patients. This is the implant I would choose for myself. It's natural feeling. It's filled with saline, so I don't have to worry about rupture. Complication rates are low, and patient satisfaction and surgeon satisfaction is really high. Plus, it's only offered by board-certified surgeons, and it was made by a board-certified plastic surgeon for plastic surgeons. So to me, the choice is pretty easy.